Parents often worry about their baby getting meningitis, and it can be very serious. Meningitis is a serious infection which affects the membranes that surround the brain and the spinal cord. Anyone can get meningitis, but babies and children under 5 are most at risk. Meningitis can be very serious and the baby may deteriorate very quickly. If you suspect meningitis, you must seek medical help urgently, as prompt treatment is vital. Therefore, it's important to recognise the symptoms. Your baby will be very unwell with a flu-like illness and high temperature. They may have blotchy or pale skin. Their hands and feet may feel cold to touch. They may have joint and limb pain. As the infection develops, they may have a severe headache, neck stiffness, vomiting, drowsiness. Their eyes may become sensitive to the light. They may have high-pitched moaning or grunting. They may be very floppy, and they may have a tense or bulging soft spot called the fontanelle on the top of their skull. Later, you may see a distinctive rash of red or purple spots that doesn't fade when pressed. But meningitis can still be the cause of severe illness even if they do not develop a rash. It is unlikely for all of the symptoms to show at the same time, but if your baby is very unwell, do not wait for all of them to appear. If you are worried, seek medical advice straight away. If they have a fever, you should treat it. Keep monitoring your baby, check them for signs of a distinctive red or purple rash which does not fade when pressed. If you see a rash, perform the glass test. Press the side of a glass against the rash. Most rashes should normally fade. If the rash does not fade, you should call 999 or 112 for emergency help straight away, as this is a sign of a later stage of meningitis. While you're waiting for help to arrive, keep your baby cool and reassure them. Keep checking their breathing, pulse, and whether they respond to you. So remember, if you suspect meningitis or notice any worrying signs, seek urgent medical advice. If they have a fever, treat it by keeping your baby cool and comfortable. Check the baby for a rash and call 999 or 112 if you are worried. Keep checking their breathing and level of response. And that's how you treat a baby who you think may have meningitis. Thanks for watching. Help support St John Ambulance. Donate today.